Hi, I'm Jeff Slakey from iFIBER One KMAS. I'm really happy today to provide a conversation to you with Dr. May from Mason Health about COVID-19 and vaccinations, as well as a message from Wyeth Jessee from the Shelton School District.
Hi, I'm Wyeth Jessee, Superintendent of the Shelton School District. Today, I just wanted to really inform you a little bit about the objectives for the Shelton School District as we kick off the 21-22 school year. One of our primary objectives is to maintain in-person instruction for our students. The reason is that our students are social creatures. They really do benefit from both academic and social-emotional learning when they're in an environment with their peers and with their teachers. So what we can do here in the Shelton School District is to make sure that we maintain an environment that is as safe as possible for our students, our staff, and our families. So following the health and safety guidelines provided by Public Health and working with our partners like Mason Health, we are going to make sure that we do things like hand washing, social distancing, making sure that we're cleaning surfaces, proper ventilation, and of course, masks. We also know that one of the important things we can do, and in following Governor Inslee's mandate, is to also have vaccinated staff. Through vaccination, it helps decrease not only the transmission rates, but also ultimately the amount of time that our staff would be out. When we're doing contact tracing and we're seeing about how high the risk level is, we know that those staff members that are vaccinated can go back to work if they're not displaying any symptoms at that time or tested positive. So really, we want to again maintain in-person instruction for our students. Our staff do as well, but to do so, we got to follow the health and safety guidelines. And so today, since our conversation was around vaccinations, I would just again stress, vaccinations is also part of our main strategy in the Shelton School District to help mitigate the transmission of COVID-19. With that, thank you for supporting our students and keeping in-person instruction for the 21-22 school year.
Well, I'm happy now to spend some time with Dr. May. How are you?
Good. Thanks for being here.
This is an important time. We just heard from the superintendent from Shelton Schools, and with school starting, there's a lot of questions again about COVID. The Delta variant is up as well, and so people are concerned. There's a lot of vaccine conversations, and that's kind of what we're here to talk about today.
Yeah, happy to do so.
Tell me a little bit about the vaccine, the safety of it, and some of the side effects that people have felt since the vaccines have been coming out.
Yeah, that's a big question. The vaccine is been researched now really thoroughly. It's something that's been around in the process of being researched for several years, even a couple of decades. And thankfully now we have a good and effective vaccine, 3 options available to us that have shown to be really quite effective. The adverse effects, luckily we're able to map that out really well by now. And the reason for that is a lot of people have received the vaccine, millions, approaching hundreds of millions. And the effects that we see are mostly short-lived. It's like any other vaccine, you can feel a little sore, a little bit sick. And that's your immune system working after you get the vaccine, just like when you get the flu shot or any other vaccine, that you can feel a little under for a couple of days. But rest assured knowing that that is actually part of the process of being vaccinated. A little more uncommon, you can see some rashes at the site of the vaccine, and then severe effects are really quite rare, and so rare in fact that it's hard to even determine if they happen more commonly than just what happens out in normal society without being vaccinated.
And you mentioned that this work has been going on for decades, while COVID-19 is relatively new for us. The SARS strain that this comes under, that's what scientists have been trying to crack that code for many, many years.
Yeah. So it was initially developed with the initial SARS outbreak a long time ago.
Yeah.
And luckily we've had the technology on the shelf and ready to be used when the time came.
And how does that technology work? mRNA, explain that a little bit.
Yeah, it's a really cool technology. The vaccine doesn't include any viral components. There's no risk of possibly getting sick from it. Apart from, again, like you can have little mild side effects, but it uses your body's system to build your immune response. It uses your body system to build antibodies and ramp up your system so that if you come in contact with the virus, your body is ready and able to fight it down.
So the COVID-19 vaccine does not give you COVID-19?
Yeah, that's not possible.
Okay, I know that's something that folks have been asking a lot of questions.
It's a common question and a really good question,
Yeah.
that people are worried that can I get the COVID, or can I get COVID from the vaccine? And there's no biological way for that to happen.
Okay. We got a lot of great questions from the hospital and from the school district to go through here. Talk to me a little bit some of the long-term side effects, the long haulers that people call them and stuff like that.
Of COVID or from the?
From COVID, yeah.
From COVID, oh yeah, you can see a lot of long-term effects from COVID. I know personal examples aren't always the best, but I have a good friend who I played soccer with in college. He got COVID several months ago and was in the hospital in New York for a long time, and he had to use oxygen for about 6 months, or 5 or 6 months after recovering. And so we see some of those occasionally. Those are rare examples, but oftentimes people do report feeling fatigued and tired and not up and able to do what they used to physically after getting COVID, and that can last really for several months.
Well, back to your story, if you don't mind. I mean, was your friend a healthy individual
Yeah.
who did play a lot of soccer?
Yeah, collegiate soccer player.
Wow.
Mm-hmm.
So it can hit all ranges and all aspects. There's no difference on the background.
Yeah, the disease does not discriminate who you are. It can affect anyone and everyone.
Question here: since the vaccinated are still getting COVID-19, are they, when they're injected, is it really developing the antibodies? I guess this is kind of goes through the breakthrough cases.
Yeah, so there are those cases, and it goes back to primarily what a vaccine is. Vaccines, we're always breathing, which means we always have the chance to breathe in a virus. And it's whether or not our body can fight off that virus depends on if we get sick or not. The vaccine builds up our immune system so that we're able to fight off the virus when we come in contact with it. Occasionally, the virus is able to mount enough of an attack that we can't overcome it. And in those cases, people who are vaccinated, the studies are really clear that their chance of becoming severely ill is reduced significantly. Our most recent things is somewhere 80 to 95%. And then the chance of being hospitalized is reduced even more still. And the chance of dying is reduced even way further beyond that.
Another question that I've heard often and was asked here is, if I had, over the last year and a half, gotten COVID-19, do I still need to get vaccinated?
Yeah, the answer is yes. And we're still getting studies on how or when or why on that. As of yet, we do know that people who got COVID can get it again. And there's no saying that it will be less or more severe. So those who have gotten COVID before, or the virus, who have been sick, if they get vaccinated, their ability to fight off the illness if they come in contact with it again is just increased even further. So it is really important for even people who have had it before to get the vaccine. We just don't know how great those antibodies are that they make from getting sick.
And one of the other follow-ups then, I guess, too, is we move into you being vaccinated or adults being vaccinated, and then coming into interactions where kids who may not yet be eligible, 12 and under, those folks should still consider to be vaccinated when they're interacting with kids. I know we're talking a lot about the schools and things like that.
Yeah, so absolutely. It's not uncommon for, well, I should back up. It's more so that kids under the age of 12 are not yet able to be vaccinated. And we're finding with the newer variants that the virus is getting more successful, or having more of an ability. Successful is a harsh word, but it does have more of an ability to infect children. And we're seeing more and more kids hospitalized with COVID. And because those children aren't able to get vaccinated, it really presses the importance for kids above the age of 12 and adults to get the vaccine to help protect those who cannot.
Have there been any research or studies shown of what the Delta variant is doing for the long haul of COVID, or is it still too soon with that?
I think we're a little soon. I haven't read anything particularly on that. We do know that it looks like patients are able to get sicker. On the converse side, in the hospital, we know a little bit better what we're doing, but it's still very hard. It's hard to treat.
A lot of folks ask about, they want to know what's in the vaccines. They want, I guess, the ingredients list.
Yeah, and that's actually readily available.
Okay.
You can look that up from the CDC website. It has a list of every single vaccine and what the full ingredients are. Very simply, there's depending on the vaccine. The Pfizer and the Moderna vaccines are more common, and the Pfizer vaccine is indicated down to 12 years old. But very simply put, there's a tiny bit of mRNA that's broken down by the body very rapidly once it's in the body. All it has to do is get there, and the body, the immune system starts doing its work. There's a little bit of saline, essentially salt water, as a to deliver the agent, and a little bit of lipid or fat to help stabilize the whole thing, and a little bit of essentially protein to help stabilize the vaccine as well.
And then how common is that set of ingredients compared to other vaccines that people have traditionally taken over the years?
Pretty common. And there's actually, in a lot of them, you can think there is less, so they're provided with less preservative, and part of that was the quick manufacturing process to get it out quickly. So they've removed a lot of potential agents that have been known to cause reactions in the past.
Microchips?
No microchips. Unfortunately, we can't get the 5G.
The other one that I have seen is that people say the COVID-19 makes you magnetized. You can put keys on your forehead.
Yeah, there's no biologic process by which that could happen. The other interesting thing is keys are generally made out of brass and nickel, two metals that are not magnetic. So if you're magnetized to a key, it's usually sweat or something weird is happening, but it can't be the vaccine.
But it's not the vaccine.
Keys are not magnetic.
Is it safe for me to get a COVID-19 vaccine if I would like to have a baby one day?
Yeah, and it's actually really important to get a COVID-19 vaccine if you'd like to have a baby. Like I said earlier, millions upon millions of people have received the vaccine. There is not a shred of evidence that the vaccine can cause inability to bear children or have children in the future. And there also is a lot of evidence that if you want your baby to be healthy during a pandemic, getting the vaccine is the safest thing to do. There's good evidence that shows that babies can get antibodies from their mothers, and when they're born they have some protection against COVID. COVID also affects pregnant mothers in that it can affect the baby's growth and development, it can affect the placenta, and even result in higher miscarriage rates if the mom gets COVID while pregnant. So it's actually quite protective while in pregnancy. The biggest medical organizations surrounding women's health have recommended for the vaccine before, during, and after pregnancy.
Another question about women's health is whether or not being near someone who received a COVID-19 vaccine affecting their menstrual cycle. And I'm not sure if this means the person who received the COVID-19 and their menstrual cycle, although the question makes it almost sound like approximation kind of a thing.
And that question's actually come up quite a bit.
Okay.
And there's no evidence of that being possible.
Okay.
One, it doesn't affect, it's been looked into a bit, but it doesn't affect one's menstrual cycle, so periods should be normal. There are lots of things that affect that, but the vaccine probably is not one of them. And then the ability of another person receiving the vaccine having effect on someone else there's, as of yet, no plausible reason for that to be able to happen.
When it comes to the three choices that we have now, the Pfizer, Moderna, and the Johnson & Johnson, and how would you go about, or should someone look to choose one over another? I mean, I know the Johnson & Johnson is a one-shot, but other than that, should someone be looking into it more or receiving whatever's available?
So the right answer is the first one you can get whenever you can get it.
Okay.
Because they've all proven to be exceptionally safe, extremely effective, and even more effective than we ever could have imagined before all this came out. The main difference is children 12 years and up can get the Pfizer vaccine right now. And then after that, 18 and older for Moderna and the Johnson & Johnson. If someone has a huge averse fear of needles, it might be better to get one shot.
Right.
If that's what's holding them back rather than getting two. But otherwise, the right answer is the one that you can get most quickly.
Let's talk about some underlying conditions, people with previous medical conditions, and their availability to get the vaccine. How does that work? And I'm sure that's a conversation with them and their doctor.
Yeah, so everyone's a little different. It's important to meet with your doctor and discuss what they would recommend for you. However, most medical conditions, chronic medical conditions, can raise someone's risk of having severe problems with COVID. So if someone has diabetes, or kids more commonly if they have asthma or other issues like that, that raises their risks with getting COVID. So heart conditions, lung conditions, endocrine conditions, all of those actually, for the most part, those people should really get the vaccine because they're at higher risk of becoming sick if they do not. There are very few people who have true allergic reactions to the components of the vaccine, and then they need to discuss with their doctor.
Sure. Can I get vaccinated while I am currently sick with COVID?
No, you should wait until you're better.
Okay.
Yeah.
Why do I need to still mask if I'm fully vaccinated? Here we are indoors, and the new missives have come down from the state government that we should be masked indoors again.
Yeah, that's a really good question, and the answer lies in the fact that we're in the middle of a pandemic and people are getting sick. Unfortunately, the levels of people getting ill, or so many people are getting sick, that the vaccine not enough people are vaccinated to really cover enough of the population. So we're finding that occasionally, though rare, someone who is vaccinated can get ill, and they can pass that sickness on before they know that they're actually sick for a few days. And so wearing the mask is just an extra safety net to protect others around.
All the information out there, if someone is now ready to go, where do they go? Where's the best places to find the vaccine? I know there's been plenty of opportunities with Mason Health, and there's clinics coming in through the rest of the month. But where's the best place to get started on that?
Anywhere they have it. So most drugstores will have it. Most physicians' offices should have the vaccine. With Mason Health, we have it available at the anticoagulation pharmacy clinic and readily available on the website. You can always look and see that'll be listed there when you can go and get it. Even walk-in hours.
It seems to be a lot more readily available than months ago, and
yeah.
I think even down at the Shelton Farmers Market last week I saw a sign for it.
Awesome.
Booster doses. That's a lot of conversations going on now. How are booster doses being given out now, and who's eligible?
So for right now, again, someone should have a discussion with their doctor to really clarify out if that's their case. People who are severely immunocompromised should definitely be considering getting the booster vaccine. But apart from that, I would actually have a discussion with your doctor to see where you fit in that realm. Because the data isn't entirely clear yet. We're still collecting a lot of information on it, but we're reserving right now most important are the people who have compromised immune systems.
And what would the booster do to the body to help it more?
Yeah, so we find that, and just like with other vaccines, like when you think of the childhood vaccine series, hepatitis B is given in a series of 3 shots, and the Tdap isn't given in a series, same with the varicella vaccine. Many of them are given as a series. And your body, as you get a vaccine, it mounts its immune response. And with time, that can wane down. And receiving a second dose of booster, again, gets it to bump up. And the idea is that if you get that at the right timing, in the right intervals, you can really keep your immune system up able to fight the infection better for a longer amount of time.
We're coming up on the fall, and flu season is here. How is that going to impact people's availabilities to get the vaccine, or if the booster is available down the road, does it need to be a waiting period after you got the flu shot?
Yeah, you will want to separate them by a couple of weeks, but getting the COVID vaccine, I think first and foremost, because we're in the middle of being hit hard with COVID, is really important. As kids are back in school now, we're expecting that, last year we didn't have much of a flu season.
Yeah.
It used to be the most common diagnosis I would make was influenza, and I don't know if I've made it during the entire pandemic, maybe once or twice. And that's because kids were out of school, people were distanced, people were wearing masks. They work, those measures work, because the flu has been really mitigated. With kids back in school, things have been less stringent. We expect that we'll have a bit of a flu season again this year, more of a typical year. And we are worried, like people in the medical community are worried about the effects that someone could actually have influenza and COVID. So really protecting oneself is really important right now.
It's important to find the information needed to get the proper information that you need to feel comfortable, whether or not you get the vaccines or you further the information to your friends and family. Mason Health is a great way to start with that. You can go to the website. We'll put the links to that. Dr. May, thank you for some time.
Thank you.